Welcome to my show. A guest here. His name is Jimmy Moley. Mr. Jimmy, how are you doing, sir?
I'm doing well today. Thank you for having me on.
All right, sir. Thank you so much, Mr. Jimmy. Firstly, you are a sports physiatrist, if I'm correct. Can you please, sir, discuss more about yourself and how you are doing currently now, Mr. Jimmy?
Yeah, absolutely. So, yes, my name is Dr. Jimmy Moley. I'm an adult and sports psychiatrist located in the Cleveland, Ohio area. So, I treat both adults and athletes for a variety of mental health conditions and really work on optimizing their mental health and performance in all areas of life.
Thank you so much, Mr. Jimmy. And you said you used to treat a lot of artists. Have you tried to write any book in that angle, or are you planning to write any book in the coming future, Mr. Jimmy?
Yeah, so actually, in medical school and residency, as part of my medical training, I was able to do a fair amount of research with athletes through the Ohio State Athletic Department and was able to publish a few different articles, particularly about head injury and concussions. So the impact that head injuries can have on, an athlete's performance, on an athlete's personality, and what are the more common risk factors that we see for both head injury and personality issues.
All right, thank you so much, Mr. Jimmy. Firstly, I would like to dive to the point of sport physiatry. Athletes today they have to have a lot of precautions. Due to their health. They have a lot of energy. They drain a lot of energy when it comes to athletes. I would like to ask for those who don't understand what sport physiatry means and how do you think it's also differ from traditional one, Mr. Jimmy?
Absolutely. So, sports psychiatry is a medical subspecialty. So, it is more or less a division of general psychiatry that focuses on the treatment and promotion of mental health in athletes. So, to give an example, a sports psychiatrist is a general physician, either an MD or a DO, who chooses after they go through medical school to specialize first in psychiatry and then once they complete their residency can do additional certification in sports psychiatry. So there's plenty of organizations that offer this. One of the more common and older organizations is the International Society for Sports Psychiatry. That's where I obtained my certification. And sports psychiatry in general really, addresses the mental health specifically of athletes. So not only common issues that athletes face, such as mood disorders, anxiety disorders, but also specific mental health challenges that athletes face.
That also shows that that is also one type of, you know, area that doctor also do when it comes to athlete. There are many areas, but psychiatry is one of it. And there will also be common challenges faced by athletes today. A lot of challenges are happening when it comes to when, even sometimes they even get to the point of trauma. It's not easy when an athlete is trying his or her best to, perform well and it's not definitely working for him or her. It's also connected to a mental health issue. What do you think are some of the common mental health challenges faced by athletes today, Mr. Jimmy?
That's a good question. I think it's kind of almost divided into two different categories. So the first category are, common mental health challenges that really the general population faces as well. So athletes are no different when it comes to, experiencing uh, conditions like depression, anxiety, ADHD, substance use, and eating disorders. And actually, in some of those cases, athletes may actually experience those conditions at a higher rate than the general population. So that's kind of one category, right, that we need to be aware of. And then the other category that I like to think of are kind of unique issues that athletes face. So this could be things like performance anxiety, response to injury and the recovery process, concerns about body image and weight management, particularly in certain sports where that is a high priority, such as wrestling, cheerleading, powerlifting, that sort of thing. And then towards the end of an athlete's career, thinking about retirement. So what does that look like as a transition to a different phase of life? So we kind of have those two categories, right? We have the initial kind of more common general mood anxiety disorders, but then we also have those unique issues that athletes face that oftentimes may be overlooked or may require more of a specialist perspective to address appropriately.
Well, thank you so much for the insight, Mr. Jimmy. And I would like to also dive to the point of relationship. Having relationship with athletes, as a medical person, could be easier, and it could also it could be difficult as a psychiatrist, Mr. Jimmy. I would like to ask what role you think a psychiatrist play in fostering positive relationship within a team, Mr. Jimmy.
No, it's a really good question, and I think a really important issue, right? So, the relationship between a sports psychiatrist and an athlete is very important, and it can be difficult to establish trust, right? So, within a team setting, there's a lot of different people, right? There's the coaches, there may be trainers, different members of the team, parents, especially in youth sports, right? So you have to be very mindful, I think, of all the different relationships that are happening at the same time. So I think the first and foremost is to establish trust with the athlete or patient that you're treating, right? So that's going to be the basis for everything that we do. So with that comes confidentiality, making sure that the player feels comfortable with that relationship, and really addressing all of their issues in a very holistic, respectful, and evidence-based manner. So once that is established, I think then hopefully that affects relationships on the team. But then there's also the role, I think, of the sports psychiatrist outside of the individual provider patient relationship, where they can provide education to the team, maybe in terms of educational lectures, kind of like, public service kind of announcements, presentations that really can hopefully reduce the stigma of mental illness and make it a topic that people feel comfortable talking with, both with their psychiatrist, but also with all of those different people that I mentioned. So, kind of making sure that everyone's on the same page, being respectful of those issues that may come up, and hopefully, as a result of that, really fostering positive relationships within a team.
Thank you so much, Mr. Jimmy. And I also like to dive to the point of pressure. As an athlete, they start from somewhere. And the more they start, the more they start to build and continue to grow and continue to get better, the more tougher competition will be, the more harder they are going to achieve the point they have to, because they have to compete with other teams. So I would like to ask, how do you think youth athletes, that's the young ones today, build resilience against the pressure of competitive sport, Mr. Jimmy?
Yeah, that's an excellent question. Youth sports are, becoming a gigantic industry. Not even becoming, they already are, right? A big industry in the United States and around the world. And youth athletes face a variety of, I think, different and unique challenges, even from adult athletes, right? So as I mentioned before, there's more players involved, right? There's the parents, there's academic requirements, there's different coaches, club sports, league sports through their school, right? And I think, a growing trend too is this kind of demand for specialization, right? The idea that instead of, maybe playing a winter sport, a summer sport, and a fall sport, that maybe you just pick the one that you're most interested in or best at and really focus on that year round. So there's tremendous pressure, like you said. And I think the ones who are successful, right, the youth athletes, the reward oftentimes is just additional pressure, right? It's higher stakes. It's playing in more leagues, more times, more games. So I think we really need to be aware and I think do a better job of understanding the pressures faced by our young athletes, really emphasizing and keeping in mind the reason that we play sports and that we get involved in the first place, right? Which for many athletes is camaraderie, is being part of a team of learning life lessons that are transmitted through sport and relationships with sports. So um, I think really emphasizing that first and foremost, but then also learning to recognize issues, right, in youth sports and pick up maybe when athletes are beginning to suffer from burnout or excessive pressure and knowing when and how to intervene, right, in those situations. So, maybe an athlete starts to struggle more in school, especially as they're growing, right? And maybe that's a warning sign, or athletes becoming more isolating themselves from themselves, their teammates, their coaches, right? So those kind of things, knowing when and how to intervene, and then I think also to touch on the specialization piece, understanding that sports in a lot of ways are meant to build well-rounded individuals, right? So that developing a wide range of skill set can be very important and can really help an athlete in all different sports if they get a lot of exposure to different teams, different environments, and that sort of thing. So really, I think learning to recognize the warning signs and keeping in mind that reason why sports are so valuable for young athletes is going to be really important as we go forward.
Yeah, it's definitely not easy for young athletes. The more you get better, the more the competition, the more the pressure. It's definitely not easy. And an athlete can get to a point whereby it's not easy when you watch your friend or your colleague having some sort of injury. And even if the athletes even get to the point of having an injury, that fear will be there that injury really really it's really really affects one career. I will put it that way. It's not easy for an athlete to have an injury, and to prevent that re-injury could make him have some fear, doubt, and even make him or her perform less when it comes to competition. I would like to ask Mr. Jimmy, how does the fear of re-injury affect an athlete's mental state and performance, Mr. Jimmy?
Absolutely. You're so right that injury is such a key point, right, in an athlete's career and presents really an opportunity to kind of go one of two ways, right? Injury can motivate a player to get back in the field, allow them time to reflect, grow, and heal to get stronger. But injury also has the potential to really derail an athlete's career as well. I think in sports, especially like we talked about youth sports just a minute ago, right?
Yeah.
That sports become really an athlete's whole identity in a lot of cases, right? That's how they identify, that's how they see themselves, and an injury can threaten to take that away. It's oftentimes very sudden, right? Very unexpected, and that kind of sudden and immediate shift can be very jarring. In a lot of ways, I like to talk to athletes and patients about treating it almost as if it's a grief process, right? As if you're grieving the loss of kind of your former self or your former way of life. And as we know, the five stages of grief and being able to work through that and process that is really a process and one that I think should be respected. So I think, the recovery process can be very long, can be very arduous, and kind of being able to build resilience and work through that, right, is very important. So, I think the fear, the specific question you asked, the fear of re-injury, I think is so significant because an athlete has already seen what that injury did in the first place, right? It took away a lot of aspects of their identity and their
Mhm.
performance. So, um, yeah, it's a big mental hurdle, absolutely, and I think just really only emphasizes the need for support systems for good, not only um, kind of sports, general care and physical therapy and rehab, but also addressing the mental side and recognizing that this will be a challenge and that it's something that needs to be addressed instead of just kind of swept under the rug, and which oftentimes can make the issue only worse if it were to come back again in the future.
Completely agree. It's definitely a tough one. And the confidence and the strength is what the athletes definitely need. And I do not know if there is any misconception when it comes to mental health, when it comes to connection with mental health in sports, in athletes, Mr. Jimmy, you would like to personally correct. If there is any, Mr. Jimmy, what do you think is maybe probably one of the misconception you feel about mental health in sports that you probably like to correct, Mr. Jimmy?
Well, there certainly is. And, I think in one respect, we've come a long way in reducing the stigma of mental health in sports. And that's really, and thanks to, high level athletes, Kevin Love comes to mind as certainly one that has helped raise awareness. And there's been plenty of others, right, that have openly spoke about their mental health issues. So I think in a lot of ways that helps reduce the stigma and helps people understand, what's challenges that are uniquely faced by athletes. Now, with that being said, I still think we have a really long way to go, right? I think that many athletes are still very hesitant to speak up about mental health challenges. I think, issues, especially like depression and anxiety, are seen as forms of weakness instead of, mental illness or signs that someone may need extra help. So I think, if there's one thing I'd like to continue to work on and address, it's this whole idea of stigma about mental illness and how we address it, particularly in that sports arena. We see all the time, right, on TV. People talk about, well, so and so, it's just kind of got to their head, or somebody has the yips, right, or things like that, and that is probably reflective, right, of some kind of mental health condition. But I think the way the conversation often goes about that, it can be somewhat derogatory, right? It can be definitely stigmatizing. So I think the way we discuss these things, the way we treat mental illness, we've made a lot of strides recently, no doubt, especially I would say in the past 2 to 3 years. But I think it also reflects how far we have to go in our understanding of mental health in sports and how we treat it as a culture in society.
Exactly. I completely agree with you, Mr. Jimmy. And lastly, Mr. Jimmy, there are a lot of athletes, even several athletes, that they have these mental health issues. But for them to seek help is something they are really hesitant about. They feel like probably maybe if I want to seek help, probably just for this mental health issue, it could be like a personal weakness. I do not know what to do. What advice do you think you can give to an athlete struggling with mental health issue but hesitant to seek help, Mr. Jimmy?
No, you're right. It's very important, and I think the first very clear message is that you are not alone, right? That there are countless athletes and people in general society, right, who struggle with similar issues, and it can be really hard. I think when you're in those moments, it feels like you're the only one, right, going through what you're going through, and you think about we watch athletes on TV and in person all the time, right, who have a big fumble in a big important game, right, or miss an important free throw at the end of a basketball game. Uh, so first and foremost, to know that you're not alone, right? And then I think also know when and where to look for help, right? So more and more, I think teams and leagues are employing sports psychiatrists and involving psychologists and other mental health professionals. So knowing when and where to look for help, understanding that doing so is not an admission of weakness, right? That it actually, on the contrary, can actually be a tool to help you just like rehab or strength training or anything else is a tool, right? Mental performance can actually be an asset to your performance, right? We see athletes all the time talk about gaining that mental edge. So not only is it a way to help yourself when you're feeling down, it's also a way to elevate your game and your performance. So don't always want to make it about the negative, right? It can be very positive as well that it can really elevate your game. And then lastly, just to treat things, very seriously, right? To take this stuff very seriously because there are very serious consequences. Unfortunately, in the past years, we've seen where things can kind of, escalate to the point where athletes consider, suicide and other, very serious negative consequences, right? And it's just, it breaks your heart to kind of see those stories because of the effect it has on not only the individual, but their families, their coaches, their teammates, and that sort of thing. So to understand the warning signs, to understand when and where to seek help, and to kind of gain the understanding that this is not an admission of weakness, it's actually an admission of strength and a way to improve your overall life, I would say, is probably the main message that I would like to communicate to athletes.
That's why I'm also definitely glad for this Faxa Streets. If I don't know if I'm correct, but Faxa Streets, this sports Faxa Streets, who are definitely impacting this mental health issue some athletes could be facing, and it has definitely helped a lot of people today. Even you yourself personally, you have helped a lot of people today. It's definitely not easy. It's a tough journey, and we just have to, as athletes, you just have to continue to push on and continue to know you're not alone. Thank you so much, Mr. Jimmy. Mr. Jimmy, there's a question I normally ask, sir. From the ancestors, from the forefathers, there are a lot of things that do exist during our ancestral time that is missing in our time today. If there is anyone or anything you would like to bring back to our time today, what do you think that thing will be, Mr. Jimmy?
Oh wow, that's a good question. I think we've grown a lot, right, as society over time, but I do think one thing, especially in modern day, right, is kind of that personal connection. I think that oftentimes can be missing. I think, excuse me, as we go on and have advances in social media and online ways to connect, I think that personal connection can be so important. And having conversations, talking, listening to one another, I think, and probably in the past was more important because it was the only way to communicate, right? But now I think is more and more important to really emphasize personal relationships, personal connections. In the field of psychiatry, that's one of the things that I pretty much do all day, right? Is talk to people and build relationships. And I think the value of that really needs to be remembered and emphasized, especially in modern society.
Hmm. Thank you so much, Mr. Jimmy. I completely agree with you. I want to personally, sincerely thank you for the opportunity, for the time on speaking on the topic of sports professionals, the athletes, and every single area that that you could just give enough insight. Thank you so much, Mr. Jimmy, for the time and the opportunity. Thank you so much, sir.
No problem. Thank you so much for having me. I appreciate it.
All right, so have a wonderful day, Mr. Jimmy. Bye bye.
Bye. Thank you. You too.